Hello Baltimore, it's Dr. Jeff Kalkstein with Drs. Adolf and Kalkstein, your Baltimore area chiropractor, and I'm with Stephanie here today. And Steph came in, 2 weeks ago maybe? 3 weeks ago? About a month ago, yeah. And what brought you in, Steph?
I have TMJ.
TMJ.
I clench my jaw, and my jaw pops every time I open.
Yeah. Did you get any headaches with it or neck pain?
Both.
You did, you did, yeah. So, and what we were doing with Steph is we were doing a technique called dry needling, right? And we were doing soft tissue work or something called active release technique, right? And I also adjusted your jaw, your neck, and your mid-back, right? Yeah. Yeah. So what I want to do is I want to show you all the dry needling, and we're not going to go through the whole routine. We'll show you how we put a couple in, right? Then we're going to show you how we do a little active release, and I'll show you how we adjust the jaw and the neck for TMJ and upper extremity joint dysfunction. The trigger point, the dry needling, we put them into trigger points, and specifically for the TMJ, so go ahead and clench up for me. The one muscle we're going to do is the masseter, and here's what it looks like in an anatomy book. You can see it right in here, and it runs from this angle like that. And then there's a little bit of temporalis. Sometimes we work on that. The other muscle we go after is the pterygoid, right? And here's the medial pterygoid and the lateral pterygoid, and so we'll put a few. The X marks the trigger point, so that muscle runs like this, right? And we're going to put needles in there. So I think it sometimes helps you to see the actual anatomy and in a book and actually where we're going to place the needles. Okay? All right, you ready? Mm-hmm. Okay, so go ahead and clench, Steph. Yeah. Okay, so we're going to start with a masseter first, all right? And we use a 1/2 inch needle, right? And we just tap it in once, and then we set it, right? And I like to put them in just a little bit to start with, and then I follow up with sometimes a little twist. Okay, there, you can relax now. Relax, don't clench. So again, we're just doing the masseter first, all the way down. That's a crooked one. There we go. There we go. And then we'll set a couple across the pterygoid for illustration, right? There we go. And one more into the pterygoid. All right. There we go. Okay. All right, there you go. All right. So that's the dry needle. We'll let them sit in there for about 10 to 15 minutes, all right? Then we'll take them out, and then we'll move over to the active release technique. We pulled the needles. Now we're going to do some soft tissue work, okay? So Steph's going to go for a ride. And we're going to work inside and outside, okay? Steph, what side hurts the most? Right side, yeah. So Heather, if you want to go onto that side, I think it'll be a better angle for you. Okay. So go ahead and open and just gently close, just relax, 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 relax. Okay, so again, now we're just going to work and lightly massage those muscles of mastication, the masseter and the pterygoid, okay? And when we first did this, that was pretty uncomfortable, wasn't it? Mm-hmm. Yeah. Get a little bit easier? Mm-hmm. Yeah, go ahead, open for me now. Yeah, beautiful. Good job. Go ahead, close. Just relax. Let all the tension out. There you go. Go ahead, open again for me. There you go. Very good. Now close. And then one more time. Go ahead, open. Very good. Good. Okay. All right. One more time. Open. And all the way down. So that's the inside. And what I like to do is I like to come to the outside. And if you come on down this way, Heather, we're gonna work on the outside also. Okay. So go ahead and open for me. There you go. Beautiful. Good. Now close. Open again. There's the masseters right there, okay? Now one more time. Good. And sometimes we'll even come up here, and I don't know if I've done this to Steph before, but we're going to get the temporalis. Go ahead and open. Yeah, there you go. Good. Good job. And back over. Good. Good. Very good. There you go. So we'll pause right now. We're back. We're going to check the range of motion of the TMJ. And Steph, when we put the needles in, is it uncomfortable at all? Mm-mm. No. And when you started, your pain was a 9. It's down to what now?
3.
3. Okay, so go ahead and open for me. And yeah, go ahead and close. And open one more time. There you go. Good. So I'm looking for the side that's fixated, and sure enough, she's fixated on the opposite side. So open slightly for me and relax. So it's just a real gentle motion like that. Okay, now go ahead and stand up for me. The next thing I want to do is I want to check her cervical spine. So come on up here for me. On your back, on your back. So it was actually her left TMJ that wasn't moving as freely as the other side, okay? And then go ahead and lift up for me and back down again. So again, I'm going to adjust the left's upper part of her neck right here. There you go, nice job.
Just that the main thing was the pop in my jaw, and that's completely gone. And I feel like it's just realigned the way that my mouth opens, which helps.
Yeah. How about eating different types of food? Is it getting easier?
It is. I mean, I have to make like a conscious effort to bite correctly,
Yes.
but I just avoid chewy things too.
Yeah, that's a big thing, like hard, crusty pizzas and thick pieces of steak. You gotta stay away from that stuff, but we're gradually starting to introduce some of those things back in there. Nice job. Okay. Thanks, Baltimore.